Acute pancreatitis is a common condition we see in our clinical practice, especially in the emergency ward, and this is most often due to alcohol consumption. Sometimes it's due to gallbladder stones, and a couple of other times due to hypertriglyceridemias, because it's increased fat in the blood and so on. And actually these patients usually come with severe excruciating abdominal pain to the emergency, and this pain radiates to the back, and many a times these people are have breathing difficulty and semi-conscious and so on, and the diagnosis is not difficult to make, but at the same time we need to do blood tests like amylase lipase and sometimes confirm the diagnosis with a CT scan abdomen. And majority of these patients with acute pancreatitis, where the pancreas gland, which is situated behind the stomach, gets swollen because it's injured by either alcohol or gallstones, and majority of them become all right maybe with 1 or 2 days of hospitalization, but a handful of them may become very serious, and this can be very life threatening. These people develop what is called SIRS, where they may have breathing failure, or the blood pressures will drop, or the kidneys stop functioning, where they had to be shifted to the intensive care unit, and support systems have to be put on. And if patients survive these patients survive in the first week, they are likely to survive for long. Some of them may not survive the first week after acute pancreatitis, and the ones who survive, some of them on the 3rd or 4th week develop complication due to infection of the pancreas, where a condition called infective pancreatic necrosis and walled off pancreatic necrosis. There are certain medical terms that are used for these patients, and in such situations we need to do some advanced treatment like putting a needle or some kind of a tube into the infected cavity and draining the pus and so on, and very rarely an operation is required to treat these patients with acute pancreatitis. So by and large, this is although it's a common condition with majority of people have a very mild presentation, some of these patients develop severe complications and it can be life threatening. So how to avoid acute pancreatitis for people who are sensitive to alcohol? In other words, alcohol doesn't suit, they should avoid taking alcohol or reduce the volume. And for those who have diagnosed gallbladder stones, should get treated before they develop this condition. And a couple of others who have high cholesterol, high triglyceride levels should be treated properly. Thank you.